everyone, I'm Dr. Stan Yeatts. Today I'm going to share something that I hope will help your fertility journey. I'm an OBGYN physician with over 30 years of experience in women's health care. I've delivered around 4,500 babies in my career. Anyone involved in healthcare understands that one simple signal from the body is important to acknowledge. It amazes me how our bodies communicate with us in so many ways. For women of reproductive age, changes in cervical mucus can guide you to increase your chances of conception. Tracking cervical mucus is like having a built-in fertility monitor that costs absolutely nothing. The science behind this is relatively simple. A woman's body produces different types of cervical mucus in response to hormonal changes. The cervical mucus needs to be a bit more liquid form so that sperm can get past the cervix and beyond. One way to look at this design of creation is that the cervical mucus acts like a door. Is the door open with thin mucus, or is the door closed with thick mucus? Studies show that couples who understand and track cervical mucus can significantly increase the conception chances, potentially doubling the likelihood of achieving pregnancy. But how does it work? Well, estrogen and progesterone play a crucial role in shaping your fertility window. During the early phase of your menstrual cycle, estrogen rises, causing your cervix to produce clear, stretchy mucus. This is your body's way of preparing for ovulation. Until that midpoint of your cycle, there's relatively less estrogen, which causes a thicker, cloudier mucus that's more difficult to penetrate. There are 5 stages of cervical mucus. During your period, cervical mucus is masked by the menstrual flow. Then comes the dry days. Little or no mucus is present. As estrogen rises, you'll notice a white tacky mucus. This is your body preparing for ovulation. Then peak fertility is when classic egg-white cervical mucus appears. It will be clear, slippery, and stretchy. When you see this type of mucus, the door is open. Sperm can survive for up to 5 days in the woman's reproductive tract after passing the cervix. Try to have intercourse on 2 consecutive days of egg-white mucus to give you the highest chances of conception. After ovulation, progesterone takes over and the mucus becomes thicker, forming a protective plug. This is your body's way of saying the door is closed. But don't get discouraged if you're not seeing the type of mucus I'm describing. Every woman's experience is unique, and tracking your fertility can help you identify patterns in your cervical mucus. Here are some tips to get you started. Use additional tools as the basal body temperature chart trends with relation to your menstrual cycle. Take a closer look at the texture and the appearance and the consistency of the cervical mucus. Use a fertility app for correlation. Consult with a fertility professional if necessary. By following these steps and staying committed, you can increase your chances of conception. First, create a dedicated method of tracking your fertility data, whether it's a journal, an app, or a download of a tracking chart. Next, commit to tracking your cervical mucus daily at the same time each day. Develop a keen eye for observing different sensations, appearances, and consistencies. Take advantage of online resources and communities for support and guidance. Stork Advisor offers content to improve your knowledge and understanding, which increases your potential for success. Track your basal body temperature along with cervical mucus. This combination can significantly boost your accuracy and increase your chance of success. Finally, schedule a reproductive health consultation with a specialist in your area if you haven't experienced pregnancy after a year of trying, if you're under the age of 35, if you're older than the age of 35 years old. After trying for 6 months, it may be wise to consult that reproductive specialist. Be patient as you learn more about your body's fertility signals. Stay informed, connected, and committed. At Stork Advisor, we're cheering for you and for your success. I'm Dr. Stan. I hope this information has been helpful to you. Please add any questions or comments below the video. Thank you for joining me today.